So let's talk about cost. It's late November, and during this time of year, I'm doing my Christmas list, and I'm sure you guys are too. So imagine that you had $200 to spend on Christmas gifts, but you don't know how many people to buy gifts for, and when you walk into the store, all of the price tags are blank, right? That's the situation that we're in with Medicaid expansion. We don't know how many people will sign up for the program. Studies estimate as few as 73% of the uninsured and as many as 95% of the uninsured will enroll. We don't know how much the Medicaid program will grow. I looked at the Milliman report issued for South Carolina, and they predict that Medicaid spending will grow between 3 and 4.5%. But when you look at historical Medicaid spending growth over the last 15 years, it has grown twice as fast than that. Third, many folks claim that this Medicaid expansion is going to be relatively inexpensive. After all, we have all these free federal dollars, and we'll just fleece the federal taxpayers, and they'll pay for it, and we'll have the free Medicaid expansion. That's part of the issue. But the other part of the issue is that folks say that the childless adults who are not disabled coming into the program are going to be cheaper to cover than they actually are. The Milliman report in South Carolina, again, claims that low-income parents currently on the program and the expansion population coming into the program will cost the same. But the federal government's own data, Kathleen Sebelius commissioned a study. That data suggests that the childless adults coming into Medicaid on expansion will cost 60% more than low-income parents currently in the program. These folks are older, they're more likely to include men, sorry guys, and they're also more likely to become Medicaid eligible due to a disability. So they're not disabled enough to be on Medicaid today, but they do have health problems. Here's a picture of, I live in the Washington, D.C. area. Here's a picture of two guys that are pretty powerful in Washington. What do you think they have in common? Any answers? Well, the answer is that both of these guys have pledged to cut Medicaid expansion funding to the states. So in President Obama's last 3 budgets, he has proposed shifting more Medicaid costs onto states. In 2 of those budgets, he proposed what's called a blended rate. And the blended rate goes back on that promise of a free Medicaid expansion. What the blended rate is an average of the Medicaid money you get today and the money that Obamacare promises you. And of course, Paul Ryan gets up every day and thinks about Obamacare, and in his budgets, he eliminates all Obamacare spending, including funding for Medicaid expansion. So remember this point the next time someone tells you this is going to be free, especially when both parties would suggest otherwise.